So we're telling the public and the Premier that cutting public services is not the way to weather an economic storm. It's our members and their paychecks that in fact create jobs and create opportunities for others. Our members spend their money locally, our members spend their money in those communities, and it's our members that, that enable communities to carry through during periods of economic downturn.
In home care, we cannot accommodate the patients that are presently being referred to us because competitive bidding is driving staff out of the sector. The Ottawa Citizen recently reported that the Champlain Community Care Access Centre left $2.3 million unspent this year, not because they didn't have a demand for health care, but because they couldn't find staff that was willing to work in a sector that treats them so poorly. Despite 2 moratoriums prompted by community outrage over the loss of home care contracts, David Kaplan has already said competitive bidding is to resume again this fall. This is a tragedy, especially in hard times when people are looking to us more than ever. If hospitals are given 2.1% this year, about 5,000 full-time equivalent jobs will be gone before the end of the fiscal year. Given the significant part-time work in our hospitals, that could translate into more than 7,000 real jobs for the Ontario workforce.
Approximately 20 to 25% of all hospital acute care beds are today occupied with patients that simply have no place to go.
The government seems to think that if they continually say healthcare spending is unsustainable and out of control, then our citizens will believe it's true. The reality is, total healthcare spending as a percentage of our overall economy is about the same as it was in the early 1990s.
Women's shelters, children's aid societies, developmentally delayed, and Canadian mental health programs must not be cut. In a recession, the worst hit are those who already are the most vulnerable.
The laying off of approximately 5,000 hospital, healthcare and support workers will not keep Ontarians healthy, will not assist in reducing wait times, and will not provide better access to healthcare. In fact, during recessionary times, demands and healthcare needs increase, not decrease. We don't stop aging, unfortunately, and we often get sicker. During recessionary times, governments are pressured to make budget cuts, impacting low-income families, the disadvantaged, and the elderly most.
83,000 Canadians lost jobs in February. How can we possibly look at cutting back on the very people who support workers and their families facing economic stress?
What we're going to call on the government to do today is to set up an economic summit, a provincial summit, where they call business, labor, and the government together so that we can come up with the solutions and come up with the plans that we need to move into the future.
Municipalities do not take their snowplows off the road when their budgets are spent. And in our present economic winter, we shouldn't be cutting our healthcare system when people need it most. Thank you.